Hey guys, it's Eden, and I just wanted to spend a few minutes and talk about saline implants. Now, a saline implant, the shell is still made of silicone, but it's the inside that's different. It's filled with a sterile saltwater solution, also called sodium chloride. And sodium chloride is what's in the IV bags at the hospital when you go, and if you're dehydrated or if you just happen to go to the ER for whatever reason, they'll give you a bag of sodium chloride. So for me, that's one of the big pluses of having saline implants, because if you happen to have a rupture, your body's going to absorb it. It is so bright out here. I didn't even think about that before doing this. Another cool thing about saline implants is that your incision site will be smaller, because when you start out with a saline bag, it's just an empty shell. So you can fold it up and put it into the breast pocket, which allows for a smaller incision site, so you can inject the saline after the implant's already put in place. A common question is, what does a saline implant feel like once it's in the body? And it really just depends on how much breast tissue you start out with. So someone who starts out with an A or a small B will probably have more firmer of an implant than someone who starts out with a larger B or a C naturally, because they have more breast tissue over the implant, which will give it a more natural feel. Also, with the saline implant, it has a little valve on it, and that's where the saline solution will actually be put in. So that's different than the silicone implant, because the silicone implant comes pre-filled, so it's completely smooth all the way around. Now, with either implant, there's going to be pros and cons to both, but one of the, I'd say, the most popular cons to saline implants, and to me too, is that there is rippling. And rippling is where the implant, the shell of it, kind of folds onto itself, so it kind of creates a rippling effect under, or actually on, your breast tissue. So sometimes, not always, on the bottom portion of your breast you can sometimes see rippling, and that's just where the implant is folding on itself. But a lot of surgeons will overfill the implant, which is putting a little bit of extra saline in there to kind of make it more taut of an implant to reduce the chances of having rippling. So that's something to talk to your doctor about if you're interested in saline implants. Now, I have saline implants. They're 375 cc's, overfilled to 425, round, under the muscle, mods. So it's not the Mod Plus or the high profiles, but mods. So they're more of a low projection and a little wider base. So I really like my implants. I have minimal rippling on the lower aspect of one of my breasts, and it's only when I bend over when I see it, so, you know. So even though my implant was overfilled by 50 cc's, I still have rippling, but it's not enough that really bothers me, and I'm okay with that. I feel like the benefits kind of outweigh the risk, in my opinion, when I compare saline to silicone, because if I had silicone and I had a silent rupture, I would be paranoid, hypochondriac freak. So that's just me. So that's why I chose saline, because as soon as I have a rupture, I'm going to know immediately, and that will put my mind at ease. So regardless of whether you choose saline over silicone or silicone over saline, it's your decision, and as long as you're 100% confident that that's what you want, then that's what you should get. I made a pro-con list listing all the pros for saline, all the pros for silicone, and the cons for both. And for me, I just happened to lean towards saline, and that was the best decision for me. So whatever your decision is, as long as you're 100% sure that that's what you want, then that's what you should do. So thanks for tuning in, and next time I'll be talking about silicone implants. Thanks.